Get ready, get ready, get ready. It's Let's Talk Business with Cheryl J. Cousteau, and I'm here for the second hour of our show with my co-host, Dr. Sinead Davis.
Hello, hello.
As we still navigate through this pandemic, we are not in Touch News Radio studio. We are still doing the show via Zoom. And so, to our radio listening audience, the YouTubers, all of those that are on our social media platform, we thank you. We thank you for your patience. We thank you for spending your lunch break with us. We have two phenomenal guests on our show today. Be sure to use your Facebook if you wish to ask the doctors a question. Yes, we have one, two, three, and a soon to be, three doctors in the house today. Woo! So, Dr. Davis, I'm excited, but I'm glad we got these therapists because I need to pivot a minute. I'm going to introduce them, and then I've got a question for both of them for some HELP.
All right.
Our theme today, as you know, Dr. Davis's show, it's Catch the Show, that's all up in your medical business. And this one, and she'll elaborate a little further, is mental health. And mental health matters. I'm here to tell you today, it matters. So let me welcome first Dr. Shanae Simmons. Welcome to the show. I know that only you can tell our radio listening audience who you are and what you are all about. But just to give them a snippet, Dr. Simmons, also known as Dr. Shanae. So let's start practicing this right now. Dr. Shanae, welcome to the show. She has a reputation as an outstanding clinician, trainer, and administrator. Dr. Simmons has excelled as an innovative troubleshooter and with an ability to process complex situations promptly. She has a knack for empowering mental health professionals by motivating and equipping them to deliver services to very challenging populations with empathy. Now, Dr. Shanae, what else would you add to that?
My goodness, I want to hire you. Can you walk around with me? That was great. That was great. So yes, you're right. I am Dr. Shanae. I am committed to our community. I think that's the thing that's most important. It's how I got here, gratefully across the street from Dr. Shanae Davis. And our practice exists so that we can make sure that quality mental health care is available and accessible at affordable rates in the community. I think that's the most important thing. There's a lot of things I could, go into, but I think most importantly for this month, the goal is so folks understand that mental health matters, it is available, it is accessible, and it is affordable. And thanks for having me.
And you know what? At the end of the day, that's really what's important. You, with all of your amazing credentials and what you both had to do to get to this point, I love that you both just want to focus on what your practice can do for the community. Now, I'm going to take this opportunity to go ahead and introduce Dr. Kimberly Kinsler, and we're going to come back and hear from our expert. Now, I've had the pleasure of meeting Dr. Kinsler many, many years ago, an advertiser of DSI Black Pages. And she was really the first licensed, I guess you could call psychotherapist I met. But she is a licensed clinical social worker. She has worked in the mental health field for many years, treating a variety of mental health concerns with individuals of all ages, including children, adolescents, adults, and families. Thank you for your service. As a veteran of the United States Air Force serving at duty stations in Texas and Germany, Dr. Kinsler understands the unique needs of soldiers and military families. I love that. Dr. Kinsler, what would you like for our audience to know further about you and your practice?
Okay, I'm Dr. Kinsler, and Cheryl and I go, like she said, go way back for probably like 15 years, I think. When I first started, I think I just I was transitioning from social work to psychology, so it's been a really long time. I am a licensed social worker, a licensed psychologist as well, and we have a full service behavioral health practice here. I am an Army vet, and what we do here is we provide um, counseling, we do psychological evaluations, we do medication management, and once a month we also do a free autism screening for the community. That's one of the things that we have additional expertise in is autism assessments. I worked for the school district here for about 10 years, and I'm really glad to be on the program today because May is Mental Health Awareness Month. And that's very exciting for us. One more thing I'd like to share about our practice is that I'm all about diversity, as surprise. So we do have multiple languages here, and that's even more exciting. We've got Spanish, Greek, Farsi, Tagalog. So we are all about diversity, and I'm just glad to be here today to talk about mental health.
Thank you, and welcome again to both of you. This is just phenomenal. The fact that I've known you for so many years, Doctor. The two Sineads have known each other and they're neighbors. But listen, I'm going to turn the show over to Dr. Davis. But here's what I want to challenge you both, and this is where you can help me. I oftentimes will say, catch the show that's all up in your business. Today, I'm going to let you a little bit into my personal business. The matriarch of my family, the Brooks family, it was a small family. My grandparents had 3 children. My mom, Frances Jennings, was the baby. The older sister was Margie Brooks Nickerson, and the only brother was Virgil Brooks. And so she passed, and we got to celebrate COVID drive-by birthday party. We got to celebrate her 90th birthday. And I'm sure you may know her. She's a member of First Baptist Church, Dr. Davis, Marnice Mitchell, and Deborah Wilson. And that's their mom and my mom's only sister. So they're all together. They're all together now. She was the last. And I would say to both of you, and I love the fact that you work with such a diverse group, with families that have gone through the loss of a loved one. It's difficult in and of itself, but during this pandemic season, when you couldn't, go visit them or love on them, hug them, kiss them, it's been tough for everyone that has experienced this. And so I ask you two, the experts, for just a minute, and Dr. Davis will come in and take over the conversation after that. What advice, or where would you begin to share your expertise to individuals like myself and others who have just lost a loved one? Dr. Kinsler?
Okay, thank you. That's something that's touched everyone, even if it hasn't been a family member of yours. I don't think there's any of us at this point who doesn't know someone who's lost someone, be it friend or family or immediate family. So loss is very prevalent, and I know we're going to talk a little more about that as the program goes on. But and of course, what makes it more difficult is that we oftentimes can't say goodbye. So we all have these rituals that we do in our families. We have funerals, we have wakes, repast. Yeah, there you go. That's the word I'm looking for. We have to repast, and we can't do those the way we once did. And that makes it harder to cope because all of that goes along with our healing process. It helps us heal. And so we have to find new ways to remember the loved one whom we've lost. I would say, knowing that we can't do that, still connect in other ways. Like now we're connected on Zoom. Sometimes we have to get together with those family members and create new ways. I spoke about grief not too long ago, and developing new rituals for this time that we're in to say goodbye, because what we did before, none of us can do that. Cremations have increased significantly because we can't access that. So creating a new ritual that will help you through the healing process, connecting with other loved ones in other ways, be it Zoom, telephone, things like that. Those are additional ways to heal. But overall, the healing is going to come here.
Mm.
That's where it's going to come. So the things that we say to ourselves, those matter. And that's how we get through the healing process a little more efficiently during this really, really difficult time.
It's Mental Health Awareness Month, and this is just a wonderful panel to have you two share with our audience and us as we all continue to cope with COVID and entering into this next phase of COVID. And we're just so happy to have you here. I think grieving is it's a process. It's a very important process that we first have to acknowledge, what's going on there, and be okay with going through some of those things. And not everyone is okay with the feelings that come along with grief. And permission is a good thing to have. If you have a therapist on board or a mental health care professional on board, sometimes that's easy. But of course, in our community, just recognizing when a mental health professional is a good next step is a challenge, in itself. I was so sorry to hear about the loss of Sister Nicholson. Boy, she could wear a suit like nobody's business. But I have no doubt in my mind and my heart that she was ready. Um, when we talk about, loss of a loved one, even loss of these freedoms that we've had in this season of COVID, what are some of the signs? What are some of the signs that we are ready for counseling, or that counseling would be a good idea to seek?
Would love to add here. I think one of the things we have to be very careful about is not comparing. And grief is one of those areas where we do a lot of comparison, or people have these imaginary timelines in their minds about you should be done by now, or you still sulking, those kinds of comments that are very common in some of our cultures. And so the answer to your question I would offer would be when all the things that you normally do don't work anymore, and whatever that is, because we all have, four of us here right now, we could all have very different strategies for how we get through stressful situations. But sometimes when a crisis comes or something unexpected comes, those tools don't work anymore. And helping professionals is a tool, is another tool. I tell folks, you don't have to discard all the tools that you have in your box, but sometimes we put the wrench down because we need the hammer. And so you can consider that the therapist is another tool that you're adding to the toolbox, and don't see it as a threat to the things that you previously done. Now, there are times where we do need to discard some things because they haven't been helpful. But I think the best single approach in making sure that we're not doing comparisons is when a person recognizes that what was working is not working anymore. That could be prayer, that could be friendships, it could be the pastor, it could be whatever. And I could go down a long list, but I won't do that. And so that would be my offering to that particular question.
I
Well,
think that
thank
is,
you.
I think that's just
Thank
so
you both so
important.
much.
What's not working is what was working is no longer working, is an important sign that something new needs to be done. Um, it can also be, perceived as trauma, particularly when loss is of someone close. Dr. Kinsler, you talked about your history as a veteran. I have no doubt that you've seen some people, some of your patients have PTSD. Post-traumatic stress disorder doesn't always come as a result of, being in war or
Right.
being, in a violent relationship. Can you talk to us about PTSD and any links there are with grief?
Let me, well, let me say one thing to begin with PTSD. PTSD is entirely treatable. It is not a lifelong sentence. And I think that's a misconception that we have in the community at large, that if I get PTSD, my life is over. I'm going to have this for the rest of my life. And you can learn how to cope and how to integrate it so that you make sense of it and then move forward. Because we, in some regards, we have all been exposed to some kind of trauma, particularly in our African American communities and minority communities. We've been exposed. Now, when it comes to grief, a connection to PTSD, and um, PTSD is that clinical diagnosis. I'm a little bit, I'm going to say trauma, because depending on how you lost a person, you absolutely can develop symptoms. You most definitely can. And is it traumatic? Absolutely. But just know that there are people here who can help you through that. And you can go on to have a wonderful life and enjoy the best that there is for you.
I like that a lot. That trauma is, you can recover from trauma.
Mhm.
That some loss, particularly when loss is unexpected, can be traumatic.
Oh, yeah.
Depression in our community, in minority communities overall, sometimes is perceived as weakness. And we deal with it with, prayer or ignoring it. But going to a healthcare provider, considering medication, that sometimes is not even a consideration. However, when they get to a point where counseling is something that they may consider someone experiencing signs of depression, we can come to people that look like us, and that's very important. I've learned that African Americans don't experience mental health issues any more or less than white people. However, our issues tend to be more related to violence, and trauma and loss and things that are, so significant. Depression is lifelong. It's manageable. It is chronic, unlike the trauma of PTSD, even if it's associated with grief. What do you do that's unique and different for our community in managing depression, each of you? And how would you say we are most successful in managing and living with depression as African Americans?
Dr. Kinsler, you want to go first?
I'll let you. I, I'll let you go first. That's fine.
Okay. Um, I, I, I'll say this. I find that in my work, as it pertains to depression, a great deal of my work is debunking the myth of what depression looks like. Depression, generally, when you hear the word, you see this very stereotypical image that comes from media. Generally, someone who's incredibly lethargic, unkept, in a disheveled space, in the dark, overeating. It's like a bunch of just a very drastic, a very exaggerated example of what the symptomology can consist of. However, what I tend to see in my office are very responsible adults who are doing the best that they can to meet the needs of that are extensive, a lot of responsibilities, very little stress management or healthy stress management. And oftentimes it is exhibited in forgetfulness, loss of pleasure or interest in socialization, low energy, low motivation. And so they do all of their responsibilities and they have nothing else to give. And when you have a conversation about a self-care, which is that's just a whole nother can, it's like, well, that must be nice. And so my experience is really largely around debunking the myth and helping people actually recognize that what they're describing is depression, and then putting in place an improved self-care plan to that end. And when I spend a significant amount of time with someone in that experience, oftentimes as we peel the layers back, they're not living life in a way that is authentic to themselves.
Mm.
And that means a lot to a lot of different people, but that has been one of the common trends that I've found, that they're living up to a host of other expectations, and life and their responsibilities is really kind of being snuffed away, snuffing life out of them. And so we spend a lot of time really digging at that and making sure that in the midst of that, medication is a tool that is available to them, because we often have to debunk that myth as well, that you're crazy if you go to get medication. It's like, again, what do you need to be able to show up fully and live life in a way that you feel good about yourself at the end of the day? And if that means you need to see Dr. Kinsler, you need to see Dr. Shanae, then that's what that means. And we'll deal with the stigma along the way.
That was whole. Dr. Kinsler.
That was very good. The one thing I would add, you mentioned, seeing someone, you alluded to seeing someone of a similar ethnic background. That is very difficult. That is very difficult. I was reading something recently, and it said that the number of African American male physicians in 1960 was like 2.7%. And in 2018, it was 2.6. That's it. So it's a challenge. It is a challenge to find someone that looks like you. And that, I think that's one of the things that keeps us from seeking that healthcare. Because when I approach depression, I frame it as a difference between the life you have and the life you want to have. And now, if the life you have and the life you want to have, if it's like this, then it's not going to be that much of a problem. But the wider that gap, the more you have symptoms. And that's when depression comes in. When the life you want is over here and the life you have is over here. That gap, that's depression. So that's what we try to do. We try to bring that closer together. And if medication is needed, we frame it differently. We do our best to normalize mental health treatment so that when you come in, you won't find a clinical setting. You'll find something that, just looks like home. It looks like home. You're comfortable, and that's what we want you to be. We want you to be comfortable and know that we're doing everything we can to take away the stigma, because that's really big.
Yeah, I think removing that stigma is really important. And in my office personally, I've done that too. I've taken away that whole sterile look and put some signs of, nice affirmation and uplift on the wall. What are some of those signs? Dr. Shanae, I love saying that. Dr. Shanae mentioned some of the atypical ways that depression may present in minority populations, particularly. It sounded like you were, describing a strong Black woman, lots of things on the plate, doing this, doing that, forgetting stuff, all the time. I'm wondering about myself. So, but lots of stuff on the plate. And then you have poor coping strategies and wanting to do more self-care. It just being that thing that's just out of reach, time to enjoy life. You had mentioned loss of pleasure, in doing things. Also, what are some of those classic symptoms? And of course, that was a strong Black woman that I had talked about. But if there are different things that we may see in Black men or children, I'd like you all to bring those things up.
I want to throw something in really quick about the strong Black woman myth, because the idea of the strong Black woman, I think now we're hearing more about how that is that myth that society has, that Black women can and will do everything. Yes, we're strong, we're resilient, but you know what? We need help too. And when it comes to medication, if we're hurting, we need the same dose of pain medicine that you'd give to everybody else, because we hurt too. So I just want to throw that out there. But strong Black women, one of the things that we see is that facade. Sometimes we may see depression we may see it manifest as a facade. I can do anything. I don't need help. I may be, I may cut you off at the knees as soon as you cross me. But what often happens when you get behind that facade, we find out about a woman who cries in the shower because the water can run down her face and no one will know that she's been crying. Someone, if they're married, they cry silently on their pillow at night because no one can hear, because there's no safe space. That's some of the things that we see in women. And that is depression.
Mm.
That's another way that it manifests. And that's why myself and Dr. Shania exist. We're here to help.
Yes. And I would add for men and women and men, particularly that the example Dr. Kinsler mentioned about the woman that like cut you off at the knee when you mess up, like you get one time to mess up with me, that woman, that's a level of irritability and anger, which are very common presentations when I work with individuals who have depression, people of color. It's very common to see a level of irritability. Think about it. If you don't have a whole lot of energy, you got too much on your plate, you're not feeling well, you don't have time for foolishness. And so it's possible that you will come off short with people, be considered abrasive, impatient, and aggressive. And so those are other examples of manifestations that I think go unnoticed in the population.
Those labels, though, sometimes when those words are put out there, she's unapproachable. He's so aggressive. Those words sometimes are triggers. What can we do to better deal with that? If you've counseled someone that has come to you for depression, and they're talking about a lot of things in the workplace. I have patients that I know that there's depression, on board. It takes me a couple visits to get them to identify some of the symptoms as depression. They say that people in the workplace don't like me. My boss says that I'm, hard to work with. She's, difficult to approach. Those labels, and most minorities have experienced that in some form of another or another. How do you counsel your patients on, dealing with some of those things?
So some of that may very well be true. And when people come to me, I assume that they're giving me their truth. So we have to start where the patient is. And that may mean learning how to better navigate the system that they found themselves in. Because you can't always leave the system. If this is how you eat, how you pay your bills, you can't just walk away from the system. So sometimes we have to figure out how to navigate the system. And if you are depressed, what can we do to help you cope? Because it's not, to look inward, because you're the only person you can change. So
Yeah.
let's see what we can do to help you.
Funny, what I wrote down here is that what you said is not necessarily to deal with that, but listen to it. It may be a mirror moment. So I said, this may be a mirror. Yeah, absolutely.
Yes.
Well,
What
as I
about in
listen
children?
to,
I'm sorry.
I listen to you three experts, and to you, Dr. Shanae and Dr. Kinsler, your voices are just so calming. I'm really just here being helped. And again, as I listen to you, I challenge any of our family members who are listening to you, or for those who may be viewing us on Facebook, like this video, share this video as this world begins to open up, or as we're communicating with our families on Zoom, or whatever method you're using. This is real. At first, when I heard you all talk about that strong African American woman, I'm thinking to myself, well, shoot, that's all of us. At any given time, all of us need a therapist. Real, I'm just being real. We just thought that was natural. And maybe this is the time to say, it really isn't. There's something you're hiding deep within there. So we're going to take a commercial break. Ladies, you can put your logos, your books, your whatever you want to put up for 2 minutes, and we will be back after the break. But thank you so much. Remember, Facebook, like, share. You will not get this type of scenario again. Back in a moment.
Welcome to Calvin's Barbershop.
You all got to see this.
I don't even want to know what you're looking at on that phone.
Well, you should. I was learning about the dangers of high blood pressure and that we need to get ours checked regularly. High blood pressure can increase the risk of heart attack or stroke, but this text program can help keep it at a healthy range. Just text Barbershop to 97779 to sign up.
I'll get right on it as soon as I'm done with this baby panda video.
Text Barbershop to 97779. A message from the American Heart Association and the Ad Council.
It's important to plan ahead for emergencies, like the storm. When it kicked in, we had a plan.
Separated.
We were able to get in touch with each other in no time.
Idea how to find each other.
The whole experience was
the
fine.
most frightening 10 hours of my life.
If there's one piece of advice I'd offer other moms out there, it's to stay calm and keep to the plan.
Message.
Some parents plan ahead, some don't. Make sure you know where to find your family in an emergency. Start your plan at ready.gov. Brought to you by FEMA and the Ad Council.
And we are back. Thank you so much for tuning in to Let's Talk Business with SJC and my second hour co-host, Dr. Shanae Davis. The first half hour has just been cathartic for me. Dr. Davis, our guests are just phenomenal.
Indeed.
So stay tuned. It's part 2. Like, share the video, and share this information, this amazing conversation. Dr. Davis?
We were about to talk about some of the things that may manifest in our minority children, particularly in this atmosphere of COVID. Up until this point, they're starting to, re-engage their friends and whatnot now, but everybody's having to look at the outcomes of being, quarantined essentially for almost a year. Got grades being behind, you got family dynamics changing because of finances and food shortages, et cetera, et cetera. Children manifest things differently. Some of our children have, gotten these diagnoses and labels, and the first stop is usually testing. Dr. Kinsler mentioned some testing capacity that she has at her clinic. There's this concept CBT, cognitive behavioral therapy, and I am a big believer in counseling and going, for this CBT when I speak with young adults or adults, with children, and they're just sort of sharing those things with me. I want you to talk about children, your approach to them, how they may present differently, and what is this CBT?
Okay, I'll talk about the CBT, and because that's one of my favorite things to talk about. Cognitive behavior therapy. It's the idea that what's happening here will manifest out here. So the things that you say to yourselves, that we say to ourselves rather, will manifest. There's no magic, but what happens is everything that we say is a reflection of what's happening here. Nothing comes out of here until it happens here first. And I am a Christian, and I recognize that although you may not find it in mental health literature or psychology, CBT comes directly from the Bible, where it says, as a man thinks in his heart, so is he. And the premise of CBT is that we can learn to adjust, we can reframe the things that are happening here. And that comes from the Bible too, where it talks about taking every thought captive. We call it cognitive restructuring, a number of things, but it's really a psychological take on some principles from the Bible. We take every thought captive and know that whatever you're thinking here, so are you. So if you don't like the "so are you" part, that's where CBT comes in. And we teach you how to change what's happening here. So
Wow.
that's the cognitive behavior therapy.
Dr. Shanae.
I love it. I'm over here trying to contain
I
myself.
see it. I
Somebody who
see it.
sees it like me.
Yes.
Woo, I'm a Christian as well, and Dr. Kinsler put it perfectly. With our young people, depending on the age, right? Because we've got our elementary school students, middle school is the monster years. I mean, it's just a very challenging. Our public school systems don't really do a great job at helping them transition from being totally dependent to being independent in high school. So you've got that. And so for my work with young people, is really about getting connected to them and rapport building with them, getting them just as, if not more comfortable with the idea of counseling. And sometimes it also requires getting them past the fact that this is something their parents made them do and they didn't want to come in the first place. And especially if the parents are at the heart of the issue, that is not uncommon, where it's really a family issue and not necessarily a young person's issue. However, in this age currently, we are experiencing our young people when they are not well. They're It's more intense and more severe. It's just more significant than what we've seen in the past. I I don't want to scapegoat technology, but it is a major influencer, and so we're seeing a lot of challenges with anxiety. Your comparison is an assault weapon to your life, and our young people are inundated with comparison with the amount of time that they spend on social media. And so, and this is where we're doing all of life right now in the middle of COVID. It's all in the internet, all in the screens, and we can put our best picture up and all these great things, and our young people oftentimes just don't have all of the skills necessary to navigate that material. And so really getting them grounded in basic, and someone said they're not soft skills, they're necessary skills. Basic skills like eye contact, self-esteem, um, speaking, self-advocacy with respect. These are some basic things that are necessary to begin to help them even get what they need. Because sometimes what they need is some parental adjustments in the home. And then to get them to recognize, again, that word normalization, right? There's some things that are just normal to the process of child development. And then there's some things that we need to take a look at and helping them walk through that process for themselves, that gap that Dr. Kinsler talked about, what you want and what you have is not different for young people. They're little individuals too. They need help walking through that, and sometimes they just need language to help them express that. And so the work there is ever evolving. When you're working with children, I often use a lot of manipulatives. I'm not trained as a play therapist, but play has to be a part of the process because you're not going to do well just talking to a young person for 50 minutes because that's what their parents are doing all day long anyway. So you've got to find ways to connect with them, use some cultural humility that is applicable to the generation, the age that they're in, and really just kind of get down to their level and understand what their needs are. And that looks different because the times are changing.
Now, you've mentioned some words that I think is just jargon for your discipline, or maybe not. I'd like you to talk more about manipulatives. Manipulatives. My question was kind of encompass the kinds of exercises that you use as a therapist to reach, to engage, or to execute your CBT. But I'm like, she uses manipulatives.
Yes, my apologies.
No.
It's just
Manipulatives And
It's just
cultural and
tangible.
techniques of cultural humility. Tell us
Okay.
about those things.
Okay, my apologies. So manipulatives are just things that you can manipulate. They're tangible. There may be a toy, it may be artwork, it may be a diagram. In my office, I can break out Tinker toys at any given moment. There are things that help the individual grasp the concept that you're teaching in a tangible, visual, manipulated way. So that's the manipulatives.
Okay.
Cultural humility. So I'm of the opinion you can't be competent culturally because culture is constantly changing, and we went through this wave of get culturally competent. And the challenge is it culture is a moving target. It is constantly changing. And so if we maintain a sense of humility around topics of culture, that means that I recognize that I might be familiar with your background or not, but I'm willing to be a student in your world. You teach me what the variables are. I said I'm a Christian, but I have Muslim clients. We have to talk openly about what that means to them, what is Ramadan, and how does that impact what we're talking about, and begin to incorporate that in the strategies and the recommendations and the resources even that may come into play. And so cultural humility is basically is a philosophy that you're not an expert in anybody's culture. I mean, there are four of us here. We probably share some things, but there's probably a lot of things that we don't share culturally, because culture is not limited to ethnicity. We've got age, we've got religion, we've got, workplace. Dr. Kinsler is a vet. So there are a number of other areas where culture comes into play. And so it's really maintaining a position that I'm an ongoing, lifelong student and using the information that you give me to help you get where you want to go.
That's awesome.
All right, and that is awesome. And I'll take this opportunity, Dr. Davis, to direct this question to Dr. Kinsler, and she can decide what manipulative she would like to use in helping us understand the differences between psychiatry, psychology, and all Christian spiritual counseling. Dr. Kinsler.
All right, that is a good question, and believe it or not, most people don't know. And even the roles that we have, those are even changing. So let's start with psychiatry. The psychiatrist, that is your individual who's gone through medical school. They've completed a residency, they've done their fellowship, they can prescribe medicine. They can do counseling too, although most do not do strictly counseling. Most of them do medicine and some counseling, but they are the ones who can prescribe medication. Your psychiatric nurse practitioners, they can prescribe medication as well. As far as your psychologists go, your psychologists, they can do counseling, and they'll often do psychological testing as well. In some places, they can prescribe medicine. Laws are changing. I know DOD, and in some states, they can also prescribe medicine. But here in Florida right now, your psychologist would be the one to do counseling and do psychological assessments. There's another one that you left out, which is your mental health counselor. They also do counseling, and your licensed clinical social workers, they do counseling as well. And now your pastoral counseling, your spiritual counseling, they are not licensed, and they don't treat mental illness. They don't treat mental health concerns. What they do is they talk to you and give you biblical counseling based on the Bible. Now, your licensed clinician will be able to incorporate the Bible or whatever it is you draw strength from as they help you, because that's what we do. We often take a strengths perspective and look at what helps you cope. And we bring those things to bear in the session. But your pastoral counseling is not licensed to treat mental health concerns. And so you really want to draw that distinction. And most pastors, if they recognize, hey, I think there might be a mental health concern here, they're going to refer you. They're not going to continue to just say pray and that's it. They're going to refer you to a professional.
The good pastor. Praise God.
A good, there you go. There you go.
A good one would. And Dr. Shanae, what would you add to that?
I think Dr. Kinsler hit it on the head. The one of the things that I communicate about the distinction between pastoral counseling and clinical counseling is the fact that while you can go to both, you cannot use your insurance to get pastoral counseling. And because one of the goals is to bridge the gap and break down barriers, we want people to be able to use the benefits they're already paying for. And so we say, try it. Go to a mental health professional, any of those levels being appropriate for your need, and get that need met using the benefit you are already paying for.
Oh,
and
that's a great
I just
point.
like
Insurance is so important. Dr. Kinsler?
I just want to add this, that when you're talking about licensed professional, you're talking about people who've been specifically trained.
Mhm.
And there's also a liability factor that enters in. So they're not just throwing out random advice or saying, here, take this medicine, give it a shot, hope it works. No, there's a liability factor. So when you are dealing with your life and your mental health, you want to deal with someone who's trained to address it properly.
Absolutely. And we certainly wouldn't want anybody just throwing it up on the wall and seeing what sticks. And that's why we have the experts. My go-to person is Dr. Davis, one of the reasons we have this show. And so, Dr. Davis, I love the fact they've broken it down. You're in a position now to where you can refer your patients and others to experts like Dr. Kinsler and Dr. Shanae. And so what would you add to that, Dr. Davis?
I would add that, we are holistic beings. And, my practice is called Your Best You. Okay. And I like to emphasize that we don't exist as just diabetes or our heart disease or even just depression or our weight. We are holistic, different facets of our life, financially, spiritually, health wise, where you work, if you work, excuse me, inside or outside, and things like that. All of those things affect us in a holistic manner. So if our thought process is off, if we have a mental health condition, yes, bringing a mental health professional onto the team is absolutely the right thing to do. The patient has more confidence in the provider, mental health provider, the pharmacist for giving medicine, if that's on board, the healthcare provider that touches them during the office visit. They feel safer to convey what's going on so that everyone is better able to, get the details and provide care that is most whole and appropriate and individualized. COVID has affected a lot of, people in different ways, especially a lot of businesses. Healthcare is not absent from that effect. We've had to do a lot of telemedicine, remote, care. Is that something that each of your practices is engaged in?
Yes.
Okay.
Yes.
How would our listeners find you online or be considered for a telehealth appointment? What goes into that? You got to see people first and then give them a telehealth appointment, or how does that go?
For us, the process is the same whether you're coming in person or not. You go to the website or give us a call, and the screening process starts. Our paperwork has always been electronic. And if you're not entirely sure that it's the right fit, we do offer a complimentary 15-minute consultation before we even start the onboarding process. But overall, the telehealth is incorporated the same way as in person. Once the paperwork is received and reviewed, and we know exactly what the fit is going to be and what means of reimbursement you'll use, we send a link to your email, same email the paperwork was sent, and you get your reminders and you're good to go.
All right. Dr. Kinsler.
Ours is fairly similar. A patient calls in. Right now, we're 100% telehealth. I'm going to say it. Let me scratch that. We are telehealth for med management and for counseling. The only thing we do in office is psychological testing right now. The process is the same. You give us a call. The front office team will do a phone screening to make sure that this is the appropriate placement for you. Sometimes people need a higher level of care. And based on what their concern is, they'll be, or their request, if they request a particular clinician, then they'll be scheduled. Or if they need a higher level of care, they'll be referred to an appropriate level of care. Because ultimately, what's most important is not necessarily that you come to this office, but what's most important is that you get the help you need. That's what's most important. And you give us a call. You can reach out to us on email, as on our website as well. But we are going to be hybrid starting in July. So we'll have some days in the office and then some days telehealth. That's just a transition. I guess everyone's kind of making that transition at this point.
Yeah.
Absolutely, especially since, well, of course, every month is Minority Health Awareness Month with the Let's Talk Business with SJC show. We always focus on minority health. However, we take an opportunity here to make sure that everyone knows that it's so important to be vaccinated. To be vaccinated means that you have a different level of freedom that we did not enjoy before. We know that our COVID-19 vaccines, all of them, do allow you to be out, excuse me, and have a lower risk of being infected with COVID-19. Also that you have a lesser chance of transmitting the virus. Certainly we'll be healthier, have less opportunity for death and hospitalization, but more importantly, to get the virus and transmit the virus, vaccination is the way to secure yourself and your family against those things. Our infection rates in the nation have gone down as a result of it. Certainly, this does not mean, get vaccinated in lieu of your social distancing, your regular hand washing, your mask wearing. And the evidence of that is that our flu season this year has been virtually non-existent. It's because we've been taking those nice, clean precautions. So with that said, I'd like for each of you to give us 3 good pointers of what we can do in terms of recognizing that a mental health concern may be afoot and how to seek help.
I'll start. I think that we talked a little bit already about recognizing that there may be a gap between how we are and what we want to be. And the word that I prefer to use over mental illness is wellness. I'd like people to consider what it would require for them to be well, and to consider allowing a mental health professional to support them on the journey towards that. So that would be my first point. Consider what you need to be well, which gets rid of this idea about being crazy, which does float around still, believe it or not, in our community. So that would be my first point. What is it that you need to be well, and consider allowing a mental health professional to journey with you towards that? Try, and try again. We don't stop going to Walmart because they didn't have what we want. We don't stop getting our teeth cleaned. We don't stop getting our gynecological exams because we waited too long, or the receptionist treated us the wrong way. And so I want to urge people to consider to be persistent in that process of finding the right match, because sometimes you will get someone that doesn't fit well. Someone might fit beautifully for Dr. Kinsler, but I might not be the right fit for them, vice versa. And it is true for all the rest of our colleagues, whether they are as skilled as we want them to or not, right? Because there's also a variant in skill and training. And then the last thing I would say is to invest in being well, and not just looking well. We have historically invested a great deal in whatever it takes to look well. We spend much more than a copay on manicures, pedicures, hair, outfits, Easter outfits, Mother's Day. We spend much more than copays on that. So I would say invest in your mental wellness, so you actually are well and you don't just look well.
Awesome.
Love that.
So we have invest in yourself. Um, Certainly, you take insurance, but there are ways to see, mental health professionals, even if you don't have insurance. Um, Maybe at the end of the hour when you tell us how to find you, etc. If there's a self-pay plan, you can, add that. You said keep trying, be persistent. If someone doesn't work for you, don't let that, you know, untoward experience, take you away from the health seeking process, particularly when there's someone out there that looks like us. I'm sure we refer to others. And also, let's not call this mental illness. This is mental wellness because it is a part of who we are holistically, our mind, body, and spirit connection. Dr. Kinsler, give us your points.
All right, I love that. I love the idea of congruence, where the inside matches the outside. So your outside can't be flying fabulous, and then your inside is crumbling. I love that. So I would say take a look at any things to be on the lookout for as signs that you might need to talk to someone and get a little bit of support. Would be any changes in mood and just your overall well-being. If people start to ask you, "You okay? Things are everything going okay?" If you start hearing those questions, take note. Sometimes people on the outside can see things that we can't necessarily see. So be tuned into that. Any changes in mood, any changes in well-being, how others interact with you. And again, that gap. Have you noticed that there is a gap? Is this the life you want? Do you always find yourself thinking, well, I wish, I wish, I wish? If that's the case, then you may need a little bit more support. I would also add physical symptoms. Most people, in fact, most psychiatric medicine is prescribed by primary care physicians. So has there been a change in your health status? Do you find yourself going to the doctor more? If so, that could be a sign that you might need a little bit more support. And that's what we're here for. You're right, Dr. Shania, it is a hard call to make, but by all means, pick up the phone. We are here to help. Nothing is worth, I'm gonna go a different route. Nothing is worth giving up. Nothing is worth, there is help available. Nothing is worth the loss of life or any of that. Help is here. We are here to help you.
That's awesome. We want to take this opportunity to thank our two specialists. Oh my goodness, our licensed specialists. It is so important that you all have conveyed to us mental health matters. We will post your contact information with our thank you post. Dr. Davis, we must schedule a part 2. You've enlightened us and instructed us to make the call. You both, although I heard Dr. Shanae say it, but I've heard you both say you're available, you are accessible, and you are affordable. You made those price comparisons. You made it real. And so it registered with us. So again, Dr. Kinsler, thank you so much. Dr. Shanae, we appreciate you, and my co-host, Dr. Shanae.
Indeed.
We thank you all. We look forward to having you back on to the show. And I need to make sure that you both are in DSI Black pages, because we don't want it to be difficult for people to find you when they need you. But thank you all. For those of us who are listening in, remember, mental health does matter. But for today, let's talk business with SJC and my co-host, Dr. Davis.
Before you say it's a wrap, do they have time to just give their website or a phone number?
Well, you can give it. We'll put it in our thank you post, but go ahead. Both of you give your website.
Okay.
We can continue on.
I am at kinslerpsychology.com. KINSLERPSYCHOLOGY, kinslerpsychology.com, 813-443-5311.
Dr. Shanae.
Yes, and I'm at communityvictory.com, exactly the way it sounds, communityvictory.com. Our phone number is 800-715-3606. Thanks for having us.
All right.
Thank you.
This show is a victorious wrap.